Welcome back to our 5 Nursing Tutorial YouTube channel. Today in this class, I'll explain about leukemia, which will come for 10 marks in the exam. It's an important topic. Leukemia. First, in this leukemia, we'll see the introduction. What is leukemia? Leukemia is one of the hematological disorder, and then it is derived from the Greek word leukos, means white. Heme means blood. Leukemia. Leukos is also known as leukocytes. He means blood. And then derived from the Greek words for white blood. And then leukemia is also known as blood cancer. Leukemia is a blood cancer that develops from the bone marrow and lymphatic system. Next, we will see the definition. Definition of leukemia. Here, leukemia is a type of cancer that affects the blood cells, mainly WBCs in the bone marrow and lymphatic system. Here, it is also a type of cancer. It is a type of cancer, and then it's going to affect for the blood cells, and then mainly it's going to attack the WBC, white blood cells, that is in the bone marrow and lymphatic system. Here, lymphatic system is a type of immune system, and then that defends against the infection. This is all about the definition of leukemia. Next, we'll see the causes for leukemia. First cause, that is exact cause is unknown or exact cause is not known. And then radiation exposure, hereditary, Down syndrome. Down syndrome, it is caused by having an extra 21st chromosome. It is caused by the extra chromosome, that is 21st chromosome. And then last cause is genetic factor. Genetic factor in the sense here chromosomal abnormality. Genetic factor is chromosomal abnormality. Here 3 chromosomal defects are there, that is deletion, trisomy and then translocation. We'll see. Deletion. Here chromosomes is to be present in with a pairs. Here deletion. Deletion means missing one chromosome. That is called deletion. And next, trisomy. Chromosomes will be in pairs. Trisomy. Trisomy means adding one extra chromosome. That is trisomy. Here what happens? Deletion. Chromosomes will be pairs and then one gets deleted. That's what it is. Deletion. It is also one of the chromosomal abnormality. for leukemia. Exact cause is not known. Exact causes unknown, and then radiation exposure, and due to hereditary, and then Down syndrome. Here it is caused by the missing 21st chromosome, and then genetic factor. Under that genetic factor, chromosomal abnormality. Here there are three types: deletion, trisomy, and translocation. Deletion means chromosomes used to be in a pairs, present in a pairs, but here one get deleted, that is deletion. And then trisomy, joining one extra chromosome, here that's what trisomy. And then here translocation. Translocation in the sense vice versa. This goes here, this comes here. That is T9 and 22 chromosomes. Cell 9 and 22 chromosomes. Translocation takes place. These are some of the causes for leukemia. Next we'll see the types of leukemia. Leukemia, here two types. One is acute leukemia, another one is chronic leukemia. Acute leukemia and chronic leukemia. And then again acute leukemia is divided into two types. That is acute lymphoid leukemia. Acute lymphoid leukemia and then acute myeloid leukemia. And then here chronic leukemia is also divided into two types. One is chronic lymphoid leukemia. Another one is chronic myeloid leukemia. These are the types. What are the types? Leukemia is divided into two types. One is acute, another one is chronic. And then acute is divided into two types. That is acute lymphoid and acute myeloid. Another one is chronic leukemia is also divided into two types. That is one is chronic lymphoid leukemia and then another one is chronic myeloid leukemia. These are the types of leukemia. Next we'll see the pathophysiology. Pathophysiology of this is leukemia. First, what happens here? In the sense, abnormal proliferation of leukocytes. Abnormal in the sense, mature and immature. Abnormal in the sense, mature and immature of proliferation. Proliferation is nothing but a multiplication of cells. Abnormal proliferation of leukocytes. There is the mature and immature leukocytes going to multiplicate. Multiplication of leukocytes takes place. That leads to failure of leukocytes to mature. First of all, it is abnormal cells, abnormal leukocytes that don't get mature. That is failure of leukocytes to mature. That is immature leukocytes. Failure to mature. That leads to metabolic complications. Metabolic complications like increasing the risk of heart disease and then stroke and then type 2 diabetes. That leads to metabolic complications leads to abnormal leukocytes cannot perform the primary function. First of all, they are abnormal, so cannot perform the primary function. So that leads to, it tends to abnormal cells crowd the bone marrow, lymph nodes and spleen. Abnormal leukocytes or abnormal cells crowd, gathered, crowd the bone marrow, lymph nodes and spleen. Then lastly, that leads to infection and bleeding. Here infection and bleeding. Infection is the invasion and then getting spread and growth of germs in the body. That is infection and bleeding. This is all about the pathophysiology. Next we'll see the clinical manifestation for leukemia. Clinical manifestations of leukemia. First there is the fever with chills. Chills with fever we can say. Joint pain. Excessive weight loss. Swollen lymph nodes. Lymph nodes will be swollen. Swelling lymph nodes we can say. And then hepatosplenomegaly. Here hepato refers to the liver, and then spleen. Megaly means enlargement. Hepatosplenomegaly is nothing but there will be the enlargement of liver and spleen. And then next is anemia. These are all the clinical manifestations of leukemia. And next we will see the diagnostic evaluations of leukemia. What are all the diagnostic evaluations? We will see. First and foremost, there is the history collection and physical examination. History collection and physical examination. X-ray can be done. CBC, that is complete blood count. CBC can be done. Needle biopsy. Needle biopsy is nothing but it is to obtain the sample of cells. To obtain the sample of cells for the lab test. That is needle biopsy. And last one is aspiration of bone marrow. Aspiration of bone marrow is nothing but it's a procedure to remove the small amount of bone marrow for the microscopic examination. These are all the diagnostic evaluations for leukemia. Next we will see the management of leukemia. First there will be the medical management. What are that one? First one is chemotherapy. Chemotherapy. It's a drug treatment that uses powerful chemicals to kill the fast growing cancer cells in the body. That is chemotherapy. Next one, radiation therapy. It's a treatment of cancer treatment that uses high energy radiation to kill the cancer cells. That is radiation therapy. Immunotherapy or immune therapy. It's also a treatment of cancer that helps the immune system to fight cancer. Gene therapy is a medical technique that modifies a person's genes to prevent or to treat the disease. To prevent the disease. Next we'll see the surgical management. Under this, bone marrow transplantation. Bone marrow transplantation. It is nothing but the stem cells are transformed from one person to another. This is bone marrow transplantation. Now I explain a easy way to remember leukemia. That is mnemonics. By this way you can remember it easily. In every competitive exams you will have a question from leukemia. In this way, by this way you can remember it easily. You have heard ALL, acute lymphoid leukemia, chronic lymphoid leukemia, AML, CML. Means what? These are the types of leukemia. Acute lymphoid leukemia, chronic lymphoid leukemia, acute myeloid leukemia, chronic myeloid leukemia. These are the types of leukemia. Now we will see the mnemonic. How we can remember, how we can answer easily in the examination by using a trick. As a normal medical students, suppose we have to know the normal amount of neutrophils and lymphocytes in the blood. Here, blood cells in the erythropoietic synthesis. On the basis of erythropoiesis, it gives us two lines. One is myeloid, another one is lymphoid. Myeloid means easily we can understand that. Of course, there will be the problem with the neutrophils. Abnormality in neutrophils. Abnormality in neutrophils, and the lymphoid in the sense there will be the defect of lymphocytes. Now we will see one mnemonic. Mnemonic by monkey. Never let monkey eat banana. Here this letter N stands for neutrophils. Neutrophils, lymphocytes, monocytes, eosinophils, basophils. Now we'll see the amount of value of these neutrophils, lymphocytes, monocytes, eosinophils and basophils. These are not the exact value, but these are the round values. Neutrophils 75%. Lymphocytes, this half, 35%. Then monocytes 5%. Eosinophils 4%. And then this basophils 2 to 3%. In our blood we have maximum amount of neutrophils and then least number of basophils. I'll just make a small graph here. You know in anatomy subject that body parts away are called lateral. Away is lateral, towards the body is called medial. Then it is medial, it is also medial. Away from the body is called lateral. This is also lateral end, this is also lateral end. Then towards means this is medial, this is also medial. Now we can write here L is there. Here L is there, that is ALL. I will write here ALL. And then last L is there, here also I will write CLL. It is acute lymphoid leukemia. What is the acute opposite? That is chronic. Chronic myeloid leukemia. And then which one is remaining? Of course, this one is remaining. This one is remained. So I will put here AML. Here it is acute lymphoid leukemia, chronic myeloid leukemia, acute myeloid leukemia, chronic lymphoid leukemia. This is just graph to remember. If you don't know anything about any cancer, any type of cancer means that time also you can answer in the examination, competitive exams. For example, take the graph like this. Of course, on seeing the age, you can clarify, you can come to know. Just seeing the patient age, you can come to know that person is suffering from this kind of cancer only. Cancer itself. You can easily come to know. Of course, ALL means it's an age of 10 years. 10 years. This one 40 years. This one ALL is 50 years. And this one is CLL is 80 years. 80 years. Here 10 years. That is 2, 3, 4, any kind, any number. That is ALL. And then CML. That is 40 years. That may be 11, 12, 13. This one 35. Up to the 40 it is CML. After 40 up to 50 it is AML. And then after 50 up to the 80, 70 to 80, that is comes under CLL, chronic lymphoid leukemia. This is the last stage of leukemia. There is no chance to survive. However, the person is going to die even though after taking the treatment. Hope you understood well. Thank you for watching. Please share, comment and subscribe my YouTube channel.